If you are considering injectable lip fillers, an expert injector, plastic surgeon, dermatologist, nurse injector, nurse practitioner can help you achieve beautiful yet natural looking results. Why would I get lip fillers? Having full pouty lips is all the rage today. If you look on the internet, women want to make their lips look full, pouty, and even sexy. Lip fillers can be a safe and easy way to enhance the perioral appearance. Viewers like youthful lips without wrinkles in the skin. As we age, our lips tend to thin and develop wrinkles and creases on the white lip portion. The corners of the mouth may gradually start to turn downward. This can create the appearance of a perpetual frown, and the diminished volume of the lips themselves only adds to the fatigued, tired-looking effect. What are lip fillers? Injectable lip fillers are injectable agents that are administered into and around the lips to make them appear attractively full and lifted. Most modern lip fillers are made from hyaluronic acid, which is found naturally in the body and is thus well tolerated by patients. In the early days of cosmetic lip augmentation, silicone and collagen were commonly used, and in fact, they were the only injectable materials. But these methods are now less sought after due to a higher incidence of complications with them. What about fat transfer lip augmentation and Botox for lips? Fat transfer lip augmentation is another option for patients who want to add lip volume that lasts longer than synthetic fillers. And while Botox or botulinum toxin is not technically a filler, it is often used as an adjunct to injectable fillers to evert or turn up the lip, the so-called lip flip that makes it look more youthful. What are the different types of lip fillers? The most common injectable fillers used in and around the lips are Juvederm, Restylane, Belotero, and Voluma. All of these injectable fillers are composed of hyaluronic acid. The great thing about hyaluronic acid is that most of these substances draw in a little bit of water, which is great for plumping the lip. The other main advantage is that hyaluronic acid fillers can be reversed with a substance called hyaluronidase, which can eradicate a lump or a bump that may be a consequence of the filler injection. Hyaluronidase can also reverse complications that occur. How does fat transfer lip augmentation work? Lips can be augmented using a person's own fat. In fat transfer injections, fat is harvested from another area of the patient's body, such as the abdomen or the thighs or even the buttocks, and then that is injected through a cannula into the lips. Patients may select this option when they want increased lip volume with longer lasting results, or when they desire augmentation in a variety of areas of the face. In this case, fat can be a great volumizing substance in many facial regions as it's abundantly available. What are permanent fillers? Many of my patients do not like needing to get frequent lip augmentation with filling agents that will go away, that are not permanent. I commonly get requests for permanent lip augmentation. There are permanent fillers that can be placed into the lip, such as Bellafill or silicone. And there are synthetic lip implants that create permanent augmentation with a small surgical procedure. Personally, I do not like any permanent lip fillers or procedures with permanent lip implants. My years of experience have told me that in the lips, permanent fillers or permanent implants cause permanent problems. For this reason, I use only dissolvable hyaluronic acid fillers, those that can be dissolved with hyaluronidase. Will my lips be swollen after I get filler injected into them? Yes, they'll certainly be swollen slightly, but most swelling and bruising should subside within a few days of the injection, and applying ice packs or cold compresses can help. Most patients find that they can easily cover minor bruising with makeup or concealer, and that post-procedure soreness and swelling resolves quite quickly without any significant discomfort. It's important to note, however, that swelling may cause your lips to appear larger than desired immediately following the procedure. Don't panic. The results will be less dramatic once the swelling subsides and the filler fully settles, which should take no more than a week or two. If you also have botulinum toxin injected around the lips, you may temporarily experience a little difficulty pronouncing certain letter sounds or a little awkwardness when eating or drinking through a straw. These effects again shouldn't last more than a few days, but if they are persistent, never hesitate to contact your injector. Does getting lip fillers hurt? Injectable lip fillers are slightly uncomfortable. However, when I place lip fillers, I pre-treat the lips with topical anesthetic cream, which lessens the needle discomfort. Additionally, all contemporary fillers contain lidocaine, and the combination of the filler agent and the lidocaine markedly reduces the filler injection discomfort. Occasionally, a very anxious patient will request a dental block with lidocaine. We used to do these all the time because when fillers initially came out, those preparations did not contain lidocaine, and we needed to do a block. However, now that most filler agents are made with lidocaine, the necessity for dental blocks has almost completely gone away. How long will it take for my lips to look normal after injections? While it may take 1 or 2 weeks for the swelling to go down entirely, most patients can expect lips to look pretty normal after about 3 days post-injection. At 4 to 5 days, any swelling is usually only noticeable to the patient themselves. Since lip fillers are non-invasive and don't require incisions or stitches, the recovery period is negligible and no downtime is required. Your lips will likely be most swollen the day following the injection, so it's best to schedule your social calendar accordingly. And just to be safe, leave a week or two between your procedure and any major events or photo sessions. Clients who are self-conscious about having any visible signs of injection may choose to have it done on a Friday after work, so that most swelling and bruising is gone by the following Monday. COVID has changed this a little bit. Will my lips look fake or too big after getting lip injections? The size and shape of lips after lip augmentation is a combination of the patient's desires, the injector's skill, and any limitations that the patient's particular lip has on achieving the desired result. Many patients considering lip fillers are afraid that their lips won't look natural, and rightfully so. We've all seen the dreaded trout pout on celebrities where the lips have been so overfilled that they're all you can focus on when you look at that face. My personal bias is to not create overinflated lips or duck lips, which I think always draw negative attention to an important part of a person's facial appearance. However, some of my patients want a very aggressive look, and I feel that the result I get on any given patient requires me to listen to their wants, and those may make me inflate a lip a little more than what I personally think is attractive. It's important that the patient and their injector have a detailed consultation in which the injector listens to the patient and also tells the patient what honestly can be achieved. Augmenting the lip relates to a patient's desire for their own personal style. It's really important that the practitioner listens to the patient regarding what the patient wants to achieve. How long does lip filler last? Most filler agents last approximately 6 months, although some augmentation can be present up to a year. However, the frequency with which each patient gets re-injected is individual. Some patients are very aggressive. They want the full lip that they tended to have for the first few weeks after they're given injection. In what I would call the aggressive cosmetic patient, they're clearly going to need more frequent injections into their lip to satisfy their personal sense of style. In patients who are a little more tolerant as their lip deflates, their frequency of injection may be somewhat longer. How much does augmenting the lips cost? The cost of lip filler injections is variable. It relates to the product used and the injector's cost to inject the product. As a general rule, augmentation of the lip costs between $500 and $800 for a single syringe of filler. It can be noted that 1 syringe of filler is the most common amount used for a given lip filler injection. It's really important that the patient does not shop price when considering lip augmentation, as a cosmetically poor injection can have devastating consequences on an individual's appearance, their smile, and their self-confidence. My advice to patients is to seek an injector who listens to your needs and has an artistic manner in the way that they look at faces and in the way they inject. Do you have questions about lip augmentations? I work with patients like you every day. Please call or email me to schedule a consultation. I look forward to seeing you in my office.